You are watching the DocTalk show.
Welcome back. We are discussing a very common disease called ulcers, or in the medical field it's called peptic ulcers. Peptic ulcers mean there are wounds that are occurring in the stomach, and in the first part of the intestines, the one which leaves the stomach to become the intestines, that is called the duodenum. So ulcers are wounds that occur in the stomach and in the duodenum. And as we learned in the previous episodes, we learned that the biggest causes of ulcers is the infection, H. pylori, and the use of certain drugs such as the painkillers. However, some other conditions may result in ulcers such as excessive alcohol, smoking, too much stress, or cancers of the stomach. So I want to learn, if someone has ulcers, what will happen to them when they visit a doctor such as a gastroenterologist? What exactly would happen to someone who has ulcers? Dr. Betty, if someone thinks
So
they have
if someone
ulcers.
thinks they have ulcers, of course, we advise that they see a trained health worker who will ask them about the symptoms that we've been talking about: pain, vomiting, blood in stool, if they've been vomiting blood, if they've lost weight,
Okay.
and the drugs they've been taking. So then they will be examined for any signs that might point to maybe they've vomited a lot and they're dehydrated. If they've been losing blood and they have anemia, that will be picked up on examination. And examining the abdomen for if they have pain to touch, if they have any swelling in the upper abdomen that might point to obstruction or to a mass, cancer in the upper abdomen.
Okay.
Thereafter, the doctor may decide whether usually they will screen for this H. pylori infection since it's very common. Yes. And if it is positive, you will be given treatment to heal the ulcer, but also to eradicate the H. pylori.
To treat
yes.
the
Yes, to
the
treat
cause.
the cause
Okay.
of the ulcers.
Okay.
Yes. So you treat so that the ulcer heals, but you also treat the cause of the ulcer.
So is it true that everyone who has this H. pylori will get this treatment of ulcers?
Not necessarily, but ideally, everyone who comes in with upper abdominal pain should be screened for H. pylori. But occasionally, people get screened for so many different reasons for H. pylori as well. So in this case, there is no consensus as per now on whether everyone with H. pylori needs to be treated for the H. pylori. But if someone has H. pylori and they have symptoms of ulcers, the H. pylori must be treated. Yes, but it's not recommended that you look for H. pylori when someone is otherwise well. Yes.
Because like you
Because
discussed,
a lot
it's a
of
common
it's a common thing in our
occurrence,
environment,
but few
and not
people.
everyone with it gets ulcers.
Okay.
Yes, so you would have to weigh the benefit of treating it and the risk, the potential risk it might pose. Yeah.
In some people, it is recommended they get the endoscopy, that procedure where they put a tube
Yes.
to look into the stomach. Which people should receive such a procedure?
So if someone has pain, we look for H. pylori, but H. pylori looks for the cause. It does not necessarily confirm that this person has a wound in the stomach or not.
Okay.
So the ideal test to prove that there is actually a wound inside the stomach is endoscopy, which is a little tube with light and a camera that we pass through the mouth, and we look directly at the esophagus, the stomach, and then the duodenum. So we view the whole stomach and the duodenum to confirm that there's actually a wound. It also helps if you suspect that this persistent pain might be due to a cancer, for example. Yes, because pain of cancer and pain of ulcers may be the same.
They may be the
yes,
same.
Yes.
Okay, and
they may be the same, and you may not be able to tell them apart just by looking at the person.
Okay.
Yes.
But since it's more common in people above the age of
Yes,
50.
so if someone is, the older people above 50 years and above must get an endoscopy because the risk of this pain being due to cancer gets higher with increasing age. So it's the cancers are more common in the older people than the younger age group. So for the younger people, you may try to treat them without necessarily confirming, but if the symptoms are persistent and if they bleed or they're vomiting, they're getting complications, then you must look down and see.
Okay.
Yes.
In the preventing ulcers, could there be ways people can prevent the ulcers in the first place? So because there's so many problems.
Yes.
And in prevention is always an important part.
So the commonest cause being H. pylori, it is actually a preventable infection. Just by ensuring good hygiene, water and sanitation, we can prevent ulcers for the most part by preventing transmission of H. pylori.
Okay.
And then also to avoid indiscriminate use of pain medicine. We've seen aspirin, diclofenac, brufen, and related drugs can actually cause.
People shouldn't overuse those drugs.
Overuse them. You should actually use them under prescription, especially if you have to use them long term. Yes.
So for those who have a condition that, like a chronic back problem, it has been there for a long time, what happens to them? Because they're at risk of getting the ulcers.
Yes. So sometimes, for different reasons, people may need pain medicine for a long time. So in that case, a doctor should supervise it to ensure, to watch when there might be danger signs and stop, or in some cases the drugs are given together with preventive measures, things that can protect the stomach lining, yes, or drugs that can reduce the acid within the stomach.
Okay.
Yes.
So at least the doctor ensures that the patient
while
is
using
protected.
it long term, the doctor is either watching to make sure that he or she identifies when there is danger, or prevent.
Is it true these herbs can treat ulcers?
I think that before we talk about the herbs, I want to talk about foods. There are people who will say, matoke gives me ulcers, beans give me ulcers. I think the foods don't necessarily cause ulcers. They may cause bloating, and for some people, because some foods produce gas, they can have pain and bloating in the abdomen. Then for those,
it isn't the ulcers,
it's not the cause of the ulcers.
Okay.
It's not wounds. They may have discomfort from other causes, not because it causes wounds in the stomach. The other thing is that once someone has ulcers, some foods may actually worsen the pain. They are not the cause of the pain, but they may worsen pain, like spiced foods, like sour fruits, say citrus, lemon, may worsen the pain because they irritate the wound. Okay. They are not the ones causing the ulcer. So I imagine that there are herbs that can soothe the pain. I'm not aware of any particular drug that is studied and licensed within our environment, but they may potentially improve the symptoms. Since the pain in the abdomen is caused by acid, anything that can neutralize the acid can bring relief.
Will bring relief.
Yes. Because some people just drink water and they feel well. Some people take milk and they feel well.
Okay.
So the problem is you need to know what you're taking. Sometimes people take herbs indiscriminately and the herbs may be mixed up and you end up with other problems. But otherwise, there is a potential that there might be.
Potential role for herbs in treating ulcers.
You are watching the DocTalk Show.